Hey, how's it going, everyone? This is FixerMed. Welcome back to my high-yield genetics review for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 3 of my multi-part video series covering the entire discipline of genetics in a comprehensive but high-yield manner. So without further ado, let's go ahead and get started on today's content. Today I'd like to mainly talk about genetic disorders, and I'd like to start with cystic fibrosis. Cystic fibrosis is an autosomal recessive genetic disorder affecting the respiratory, digestive, and reproductive systems. The main genetic basis for cystic fibrosis is a mutation in the CFTR gene, which leads to abnormal chloride transport. Main clinical features involve chronic respiratory infections, pancreatic insufficiency, salty skin, and the diagnostic tests used to diagnose cystic fibrosis include the sweat chloride test and genetic testing. Cystic fibrosis is managed with chest physiotherapy, pancreatic enzyme supplementation, and targeted therapies. All right, let's go ahead and move on to the next disorder. Sickle cell disease. Sickle cell disease is an autosomal recessive disorder characterized by abnormal hemoglobin levels. The main genetic basis for sickle cell disease is a point mutation in the HBB gene, known as beta globin. Clinical features of sickle cell disease include vaso-occlusive crises, anemia, and jaundice. Diagnosis tests used for sickle cell disease include hemoglobin electrophoresis and genetic testing. Sickle cell disease is managed through pain management, hydroxyurea, and blood transfusions. Moving on. Next we have hemophilia. Hemophilia is an X-linked recessive bleeding disorder primarily affecting males. The primary genetic basis for hemophilia involves the deficiency of clotting factors, mainly clotting factors 8 and 9. Clinical features of hemophilia include prolonged bleeding, easy bruising, and joint bleeding. Diagnostic tests include coagulation assays and genetic testing. Hemophilia is managed through replacement therapy with clotting factor concentrates. Moving on. Next, we have Huntington's disease. Huntington's disease is an autosomal dominant neurodegenerative disorder. The primary genetic basis for Huntington's disease involves the expansion of CAG repeats in the HTT gene. Clinical features of Huntington's disease include choreiform movements, psychiatric symptoms, and cognitive decline. The primary diagnostic tests for Huntington's disease are genetic testing for the CAG repeat expansion. Huntington's disease is managed through supportive care and psychiatric intervention. Next, we have Duchenne Muscular Dystrophy. Duchenne Muscular Dystrophy is an X-linked recessive progressive muscle wasting disorder. The primary genetic basis for Duchenne Muscular Dystrophy is a mutation in the DMD gene leading to an absence of dystrophin. Main clinical features of DMD involve progressive muscle weakness and difficulty walking. Diagnostic tests for Duchenne muscular dystrophy include creatine kinase level measurements and genetic testing. Duchenne muscular dystrophy is managed through supportive care, corticosteroids, and physical therapy. We'll be talking more about Duchenne muscular dystrophy in the MSK review series, where we also talk about another less severe form of muscle wasting known as Becker's muscular dystrophy. So, good stuff to look out for. Moving on. Next, we have Thalassemias. Thalassemias are a group of autosomal recessive blood disorders affecting hemoglobin synthesis. The primary genetic basis for thalassemias include mutations in alpha or beta globin genes. Some clinical features of thalassemias include anemia, splenomegaly, and growth retardation. Diagnostic tests for thalassemias include hemoglobin electrophoresis and genetic testing. Thalassemias are managed through blood transfusions and iron chelation therapy. Moving on. I like to provide a quick summary of everything for you guys. So cystic fibrosis, autosomal recessive disorder affecting respiratory, digestive, reproductive systems, mutation in CFTR gene leading to abnormal chloride transport, chronic respiratory infections, pancreatic insufficiency, managed with therapies. Sickle cell disease, autosomal recessive disorder with abnormal hemoglobin, HBS, point mutation in the HBB gene, vaso-occlusive crises, anemia managed with pain relief and supportive care, hemophilia, X-linked recessive bleeding disorder, deficiency of clotting factors, factor 8 or 9, prolonged bleeding managed with clotting factor replacements. Moving on. Huntington's disease is an autosomal dominant neurodegenerative disorder. Involves the expansion of CAG repeats in HTT gene, choroiform movements, psychiatric symptoms managed supportively, Duchenne Muscular Dystrophy, X-linked recessive progressive muscular wasting disorder, mutation in the DMD gene leading to absent dystrophin, progressive muscle weakness managed with supportive care, Thalassemias, autosomal recessive blood disorders affecting hemoglobin synthesis, mutations in alpha or beta globin genes, anemia, splenomegaly managed with blood transfusions and iron chelation. All right, going on to questions now. We have a 6-month-old infant that presents with feeding difficulties, vomiting, and failure to thrive. Physical examination reveals hepatomegaly, jaundice, and cherry red spots in the macula. Laboratory tests show elevated levels of glucocerebroside. Genetic analysis reveals mutations in the GBA gene, which of the following genetic disorders is most likely responsible for the observed clinical features. Pretty first order review questions, so if you need more time, please feel free to pause the video. If not, moving on now. Gaucher disease. Gaucher disease is an autosomal recessive lysosomal storage disorder caused by mutations in the GBA gene. Clinical features include hepatomegaly, splenomegaly, anemia, thrombocytopenia, bone abnormalities, and cherry red spots in the macula. Therefore, the correct answer is Gaucher disease. Moving on. Why the other answer choices are incorrect. Tay-Sachs disease, lysosomal storage disorder caused by mutations in the hexa gene, affects nervous system leading to neurodegeneration but does not cause hepatomegaly or cherry red spots in the macula. Niemann-Pick disease, Niemann-Pick, lysosomal storage disorder, mutations in different genes, present with hepatosplenomegaly and neurodegeneration, but cherry red spots are not typical. Elevated glucocerebroside levels are characteristic of Gaucher disease. Pompe disease, autosomal recessive disorder, caused by mutations in the GAA gene, involves glycogen accumulation, affects muscles, leading to cardiomyopathy and muscle weakness, not hepatomegaly or cherry red spots. Mucopolysaccharidosis, known as Hurler syndrome. Hurler syndrome, MPS disorder, caused by mutations in the IDUA gene, results in the accumulation of glycosaminoglycans, leading to organ enlargement and skeletal abnormalities, but cherry red spots and elevated glucocerebroside levels are not characteristic. If you guys have been watching the Biochem series as well, this was a review question styled in a similar manner, so genetics and biochem have a lot of overlap between them. In fact, I'd say genetics is a good subtopic of biochem for the sake of USMLE. Moving on to the next question. A 2-year-old presents with a history of severe intellectual disability, a distinct fish-like odor in the urine, and motor dysfunction. Laboratory tests reveal elevated levels of phenylalanine. Genetic analysis shows mutations in the PAH gene. Which of the following genetic disorders is most likely responsible for the observed clinical features? Pretty straightforward questions, so if you need more time, please feel free to pause the video. Otherwise, I'm moving on now. Phenylketonuria, PKU, is an autosomal recessive metabolic disorder caused by mutations in the PAH gene. Clinical features include severe intellectual disability, a distinct fish-like odor in the urine due to elevated phenylalanine, and motor dysfunction. Therefore, the correct answer is C, phenylketonuria, PKU. Let's go see why the other answer choices are incorrect. Tay-Sachs disease, lysosomal storage disorder, hexagene, neurodegeneration, no association with elevated phenylalanine levels or fish-like odor, cystic fibrosis, autosomal recessive disorder, mutations in the CFTR gene, affects respiratory and digestive systems, symptoms such as chronic respiratory infections and pancreatic insufficiency, does not involve elevated phenylalanine levels, galactosemia, autosomal recessive disorder, mutations in genes involved in galactose metabolism. Clinical features include liver dysfunction, cataracts, and intellectual disability, but it does not result in distinct fish-like odor in the urine or elevated phenylalanine levels. Maple syrup urine disease, MSUD, is an autosomal recessive disorder caused by mutations in the genes related to branched-chain amino acid metabolism, leads to accumulations of specific amino acids in the body, does not cause elevated phenylalanine levels or fish-like odor in the urine. Guys, that will do that all for the video today. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, this is FixerMed signing off. And as always, be sure to have a great day and good luck studying. And also, if you guys don't mind, please feel free to leave a like and subscribe. It really helps the channel out, and I'd appreciate it. So, goodbye, guys.